Hello, ladies and gentlemen, children, and inspiring surgeons. I'm Dr. Carls, and today we'll be going over the step-by-step process on how to remove a kidney like a pro. But before we get started with this video, this is not a confession of guilt nor acknowledgement of any of the actions taken in this video. Now, I'm sure we've all at some point needed some money, but we don't feel like going through the necessary years of medical school required for it. So, here's a quick 5-step process to teach you all of the necessary knowledge required for kidney surgery. Before you get slicing and dicing, you first need somewhere to perform your surgery. This can range from a typical surgical room or, my preference, a dirty motel. You'll also need an instrument to get cut in. Most professionals use scalpels, but I personally suggest something such as a rusty hunting knife or a screwdriver, anything that gets the job done. And finally, you're going to need some ice after the job is done. Whether you want to freeze your own or buy some from the local convenience store, this requires water, so sorry kids in Africa. Unless you've gone to medical school, finding a patient can be very difficult. Luckily, I'm here to share with you on how to find an easy target. There are many ways you can do this. My preferred technique is to go clubbing until I can find an easy target, usually someone of the opposite gender and the kind of person that no one really likes. You then want to approach your target and smooth talk your target until she or he is very comfortable with you. Keep in mind, it pays a ton to be attractive in order to put your patient in a more comfortable state. Also, make sure not to give any legitimate information about yourself, as this may ruin your chances of a post-surgical life. This then leads into our next step. Doing surgery on your patient while they're awake, it never ends well, trust me. And it contracts way too much tension, so it's necessary to sedate your patient before surgery. Once you find your target, wait for the perfect moment for when their back is turned, and then get some lysergic acid, some LSD, and slip it into their drink. Wait for the effects to kick in, and then whammo! Your surgery is almost ready. You then need to find a way to get your sedated patient back to your dirty motel room. Congratulations, you brought someone back home. Your mother would be so proud of you, and she'd be even more proud once you operate on your patient. Surgery is a very complicated process, and it takes years of schooling and studying to perform. If you're a nerd, put your patient in the bathtub of your motel. Put the previously mentioned ice in the tub with them, and get your trusty surgical device and get cutting, sport. It's important to remember what the kidney looks like before surgery, as an intestine will do you no good. Remember, don't be greedy. Get one of the kidneys and quickly evacuate the premises. Make sure to leave as little evidence of your existence there as possible. And now you're done with surgery, but you still got one more job you need to do. Unless you're some kind of freak, you have no need for a third kidney. This is when you pull up your laptop and sell your brand new kidney on the dark web. Kidneys are high in value, so you'll be able to find a great price with no trouble. And there you go, friends. You can now collect your pay of up to $10,000 and enjoy your life as a richer man. Thank you for watching, friends, and join us next time as we'll talk about internet scamming for pros.